wing lift uses the arms of the patient to implement position and a tightly rolled up towel as a fulcrum. It's useful when a thoracic cuddle cannot be performed or where there is noticeable deviation from the neutral kyphosis into either flexion or extension of that particular segment. For extension adjustments, we generally place the fulcrum on the lower vertebrae of the segment and extend the upper vertebrae. This looks like a push adjustment. Before you perform an adjustment, you need to test and figure out what it is that you will be adjusting. You can use segmental motion tests that should have been a part of your training, as well as observe deviations in the spinal segments that you wish to address. With wing lifts, position and force can be directed to achieve either extension or flexion of a segment. If your testing has determined that there is an extension component, then this technique may help in addressing that barrier. Once you have a position of the segment and the barriers you need to engage, it's time to set up your adjustment. Remember, safety and accuracy are your primary concerns. In this case, let's look at the T4 on 5 thoracic segment and then demonstrate how to engage the barriers identified. The barriers I need to engage at that segment are side bending to the left and rotation towards the right. We will then demonstrate how to utilize this technique to also improve extension at that segment. This 4-step process will help you achieve the basics of a safe and accurate thoracic spine wing lift into extension. Step 1. The position of the bed will be determined by the segment you wish to address and if you are using extension or flexion in your adjustment. A tightly folded towel will need to be placed just under the base of your sternum. This needs to be lined up with the segment you are about to adjust, and the bed needs to be positioned accordingly with the patient seated and their backside as close to your edge as possible. This is the correct position if you are pushing the segment into extension. Step 2. You will need to roll up your towel to create a fulcrum. Begin by folding the towel into a rectangle, then fold the edges of the towel, forming an arrow. You will now begin to roll the tip of the arrow tightly until you have a tight roll that is roughly the size of your closed fist. When extending a segment, place the towel on the bottom vertebrae of the segment. When the towel is placed on the correct vertebrae, move your sternal area into position and lock the towel between your upper diaphragm area and the patient. Step 3. Ask the patient to place their hands on their mid-thighs. With your hands, grab the patient's forearms and guide them towards the back of their neck, asking them to lock their fingers behind their neck. Find your barriers for adjustment whilst making sure there is a firm lock of the towel between you and the patient. When performing an extension adjustment, push into the lower vertebrae you are contacting with the towel whilst pivoting and extending the upper vertebrae with the arms. Continue this movement as a means to preload the segment and prepare for thrusting. Step 4. It's time to apply your thrust in a short, sharp manner. For extension, the patient will look more upright as you thrust forward with your chest and pull back with the arms. An audible cavitation is desirable, but not always necessary for success. It's now time to retest to see if you have made changes to the segment based on the testing you performed prior to your adjustment. Retest the same motion tests that you performed before the adjustment to check if you are happy with the change in range of motion. The achievement of the desired change would indicate a successful adjustment. Now it's time to apply these steps in the clinic and refine your technique.